The motor system. The motor system is responsible for generating and controlling movement in our bodies, allowing us to perform a wide range of actions, from the simplest to the most complex. It involves the integration of various components, including the brain, spinal cord, and peripheral nerves. Now let's focus on one key part of the motor system: the cerebral cortex. The outer layer of the brain plays a vital role in motor control. It is divided into different regions, with the primary motor cortex being of particular significance. Located in the frontal lobe, the primary motor cortex initiates voluntary muscle movements and coordinates their execution. Motor pathways. The pathways serves as communication highways, transmitting signals between the brain and muscles. The corticospinal tract is a major pathway that originates in the primary motor cortex and travels through the spinal cord, controlling voluntary movements in the body. This pathway enables precise and coordinated movements, allowing us to manipulate objects, express ourselves, and engage in various activities. The basal ganglia. The basal ganglia, a group of interconnected structures deep within the brain, are involved in motor control and learning. They help regulate movement, initiation, inhibit unwanted movements, and fine-tune motor activities. Dysfunction in the basal ganglia can lead to movement disorders such as Parkinson's disease or Huntington's disease. The cerebellum. The cerebellum, situated at the back of the brain, plays a crucial role in motor coordination, precision, and balance. It receives input from various sensory systems and the cerebral cortex, enabling it to fine-tune motor commands and make rapid adjustments to movements. Damage to cerebellum can result in impaired coordination and balance. So in summary, the motor system is a complex network that allows us to move and interact with our environment. The cerebral cortex, motor pathways, basal ganglia, and cerebellum are key components of this system, each contributing to different aspects of motor control and coordination.
The peripheral nervous system, or the PNS, is divided into two main components, which are the somatic nervous system, or the SNS, and the autonomic nervous system, which is the ANS. Each component consists of different structures that play specific roles in the functioning of the PNS. The somatic sensory nervous system, or the SNS, is composed of cranial and spinal nerves, and the autonomic sensory system of PNS is also composed of two parts, which are the sympathetic and parasympathetic nervous system. The sympathetic nervous system is involved in the fight or flight response, while the parasympathetic nervous system is responsible for the body's rest and digest response. Those parts work together to facilitate sensory reception, motor control, and autonomic regulation, allowing for the transmission of information between the CNS and the periphery and coordinating various bodily functions.
The functions of the motor system. The motor system is responsible for generating and controlling voluntary and involuntary movement within our body. The functions of the motor system includes voluntary movement, fine motor control, gross motor control, reflex actions, postural control, and automatic movements. Voluntary motor control is conscious control of our movements in which we do activities such as walking, writing, running consciously. The motor system receives commands from the motor cortex from our brain and coordinates activation of appropriate muscles for the desired movement. For the functions of the fine motor control, it deals with the precise and delicate movements of smaller muscle groups, in which it allows us to perform activities such as writing, playing instruments, and manipulating and controlling smaller objects. Next is the gross muscle control, in which it functions for the coordinating movements of larger muscle groups, in which it allows us to do activities such as walking, running, playing sports, jumping and throwing. It also coordinates multiple muscle groups and adjusts posture and balance. Next is for the postural control, which maintains our posture and balance. It allows us to stand and move without falling and coordinates our muscles throughout our body to counteract external forces and maintain our stability. Our postural control relies on our sensory system, such as the vestibular system, which adjusts our muscles for our equilibrium. Next is our reflex action. It involves the involuntary movement and involuntary reaction due to stimuli. An example of this is unconsciously pulling out your hand when you put it on a hot surface. Overall, these functions helps us interact with the environment and maintain our bodily functions. The peripheral nervous system. The peripheral nervous system is a branch or division of the nervous system which extends beyond the brain and the spinal cord. And it connects to the central nervous system or CNS and throughout the whole body. It carries information between the CNS or the central nervous system and the body's peripheral tissues, organs, and cells. It has functions such as the sensory function, motor function, nerve signal transmission, autonomic functions, reflex actions, and peripheral sensory processings. The sensory function of the peripheral nervous system deals with the detection and the transmission of information from various parts of the body to the CNS or the central nervous system. It contains receptors that respond to stimuli such as touch, pain, pressure, vibration, and temperature. The receptors convert sensory stimuli into electrical signals and then are transmitted by sensory neurons to the CNS or the central nervous system. For interpretation. Next is the motor function, in which the peripheral nervous system plays a crucial role in transporting or transmitting motor commands from the central nervous system or CNS up to the muscles and glands. It has motor neurons that carry signals from the CNS to the effector organs, such as the skeletal muscle, the smooth muscles, and the glands. The motor neurons also control voluntary movements and involuntary movements and regulate glandular secretions. The peripheral nervous system also has autonomic functions, and it includes the autonomic nervous system or ANS, which regulates involuntary body functions and helps regulate homeostasis. The peripheral nervous system, through the ANS or autonomic nervous system, control vital functions such as the heart rate, digestion, blood pressure, respiration, and glandular secretions. Peripheral nervous system also functions as a communication network in which nerve signals are transmitted between the CNS or central nervous system and the rest of the body. It has various types of nerves such as the cranial nerves for the head and neck region and the spinal nerves for the rest of the body. The PNS or peripheral nervous system is also involved in generating reflex actions, which are involuntary responses due to stimuli. The PNS also contributes with sensory processing at a peripheral level, meaning sensory information is processed within the PNS itself without too much input from the CNS or the central nervous system, and it allows for quick reflexive response. Overall, the peripheral nervous system is responsible for transmitting the sensory information from the body to the central nervous system.
Importance of motor system and the peripheral nervous system. Plays crucial roles in controlling movement and coordinating the functioning of our body. Here are some important functions of the motor system and the PNS or the peripheral nervous system. First, control movement. Motor system, which consists of the brain, spinal cord, and the peripheral nerves, is responsible for initiating and controlling voluntary movements. It allows us to perform various actions, from simple tasks like grabbing objects to complex activities such as playing a musical instrument or participating in sports. The second function is the muscle coordination. The motor system coordinates the activity of different muscles, ensuring that they contract and relax in a synchronized manner. This coordination is essential for smooth and precise movements, as seen in activities like walking, running, and performing recreational activities. And the next function is the reflex action. The peripheral nervous system, a component of the nervous system, connects the central nervous system or CNS to the rest of the body. It includes the sensory neurons that transmit information from the body to the CNS, and the motor neurons that carry signals from the CNS to the muscles and the glands. Through the PNS, reflex actions can be rapidly initiated, enabling automatic responses to stimuli without conscious thought. For example, when you touch a hot surface, your peripheral nervous system quickly triggers the withdrawal of your hand. Then the next function is the sensory feedback. The motor system relies on sensory feedback from the PNS to monitor and adjust movements. Sensory receptors located in the muscles, tendons, and the joints provided information about the position, tension, and movements of the body parts. This feedback allows the motor system to make real-time adjustments to maintain balance, coordination, and posture. Next function is the integration of cognitive functions. The motor system is closely interconnected with the cognitive function such as attention, decision making, and memory. Complex movements such as playing a musical instrument or typing require coordination between motor skills and cognitive processes. The motor system interacts with other brain regions, allowing us to execute precise movements based on learned patterns and adapt to changing circumstances. Next function is the rehabilitation and recovery. When the motor system is damaged due to injury, illness, or neurological disorders, rehabilitation plays a crucial role in restoring function. Techniques such as physical therapy, occupational therapy, neurorehabilitation focus on retraining the motor system, promoting recovery, and enhancing quality of life for individuals with motor impairments. In summary, understanding the importance of the motor system and the peripheral nervous system, enabling movement, coordinating muscle activity, and integrating the cognitive processes. This knowledge contributes to the development of interventions and treatments aimed at optimizing motor function and improving overall well-being.
Okay, so now that we know a little information about our topic, which is the peripheral nervous system and the motor system, let's talk about the roles and responsibilities of people who are physical therapists. So, we all know that physical therapists are those who need to learn and understand how the body works and how movement is done. Because in cases that a person loses their ability to move and control their body, it is the physical therapist's role to come in and help them regain it back. Our motor system and the peripheral nervous system plays a really huge role in creating movement. The peripheral nervous system being the one responsible for connecting the central nervous system to the muscles. And we also have the motor system, which consists of certain structures that work together to control and do movement. Through different treatment plans and interventions, these are usually provided by the physical therapists. This includes exercises, massages, and mechanical interventions. Through this, the patient's original range of motion and comfort will be restored. So, to further elaborate, explain, and understand the roles and responsibilities, we will be giving examples on one illness for each topic.
Peripheral neuropathy is one disease where the PNS is damaged, often caused by traumatic injuries, metabolic problems, and inherited from genetics. Its symptoms may include muscle weakness, paralysis, extreme touch sensitivity, and pain on certain areas subject to normal amount of pressure. If this is the case, PTs get involved by prescribing braces or splints to be worn for a certain period of time or electrical stimulation or relaxation therapy.
So, for the motor system, we have Kennedy's disease, which is a hereditary disease that can only affect the males in the family. So, it's a slowly progressing neuromuscular condition that affects the lower motor neuron. So, since the lower motor neurons transmit signal to the muscle which produce the movement, and Kennedy's disease involves the degeneration of this motor. So, it causes progressive weakness and wasting of the muscles, particularly the arms and the legs. So, the other major symptoms include severe cramps and problems with speech and swallowing. So, there's still no cure for it now, but there is medication that can manage the symptoms. So, as a physical therapist, we can recommend rehabilitation and sessions to slow the muscle weakness. We can also provide some stretches and strengthening exercise to improve and maintain the muscle strength, muscle flexibility, and the ROM, or the range of motion.
Understanding this subject will increase our knowledge and capacity to provide successful therapies to our patient. It is critical for us to have a complete understanding of this subject as a future physical therapist, since we allow us to have a comprehensive therapy to our clients and patients with neurological illness and accidents. Clinical outcomes were gained as a result of knowledge of neurological systems and illnesses in our brain, linked with the required for us to give comprehensive care to our patients as a future physical therapist and occupational therapist. We must grasp the psychological principles to govern both voluntary and involuntary movements of the patient, as well as disturbance and abnormalities that may occur. Such knowledge will provide significant insights for our rehabilitation procedures and enable us to provide the best possible care to our patients. To summarize, a thorough understanding to all the neurological system is required for us future therapists to succeed in our career and provide the best possible care to our patients and mature cases.
To diagnose patients with neurological disorder or injuries truly depends on your understanding of neuroanatomical structures. Knowing how the nervous system works will help you locate lesion, locate problems area, and assesses the effects on motor, sensory, and cognitive functioning. This information provides a basis for creating efficient treatment by assisting in the selection of suitable assessment tools and the right interpretation for the results. We can create interventions that focus on certain impairments and functional constraints by knowing the brain's pathways and connections. For instance, understanding the architecture of the spinal cord can help us choose exercises and modalities that will aid in motor recovery. In a patient who has a weakness in the lower limb as a result of a spinal cord injury, as a future PTRP or OTRP, we will often work closely with patients and their families, providing education about their condition, treatment plans, and expectations.